It's time now for Your Local Hospital on the Town, brought to you by Sierra Nevada Memorial Hospital, Dignity Health. And now, here's your host, John Cadis.
Welcome, everybody, to our Monday edition of On the Town, featuring Your Local Hospital. And today, I'm John Cadis, and today my guest is Dr. Tom Lucetti, who's an anesthesiologist here at Sierra Nevada Memorial Hospital. Welcome, Tom.
Thank you very much.
So, you're somewhat of a local boy. Your wife is definitely local, but you grew up in Roseville?
That's correct, yes. We moved to Roseville back in 1983, and I spent from 5th grade until graduating from high school in Roseville.
And which high school did you go to?
Went to Oakmont High.
Okay. So, at this point, did you have any idea you were going to go into medicine?
You know, I had a thought of possibly going into medicine, but then ended up going to UC Davis and got a little bit tired of the sciences, and so ended up majoring in economics. So I had an idea, but didn't have it, set in stone.
Okay. So, following your graduation with a degree in economics, what'd you do?
So I ended up working for Pacific Bell, which is, later became SBC, which later became AT&T.
Mm-hmm.
And for 1 year, I did an accelerated management program. So I was in forced load management, and we basically moved people around. So when the phone lines went down up in, say, Humboldt, you would end up moving people from Sacramento, and the technicians would go up to Humboldt, fix the lines up there, just making sure they had the right staff everywhere.
How long did it take you to realize you didn't want to be a desk jockey?
Not very long. I only did that for about a year. So I ended up deciding at that point, and I had it in the back of my head that I may be going this way anyhow, to go and take prerequisites for medical school, get a couple of things out of the way at Sierra College and UC Davis. And then I also worked as an emergency medical technician for AMR in Sacramento.
An ambulance service?
Correct, for about 2 to 3 years.
Wow.
While I was doing that.
What was that like?
It was exciting. That was fun. Yeah, driving around was the most fun, actually. But so anyhow, I did that. And
did you have any hands-on work?
I did, but I was an EMT. So in Sacramento, what they had is they had EMTs who mainly did the driving and were an assistant to the paramedics. And the paramedics did most of the medical care. So it was a good experience as far as more observing. I got to do some things, but it was more observing and driving around.
Wow. And you did that for
about 2 to 3 years.
Wow. So once you got your prerequisites out of the way, you actually got into medical school at UC Davis?
Yeah, actually, I ended up going to Case Western Reserve.
That's right.
Yes, so I ended up going to
Cleveland.
In Cleveland. So I ended up going to Case Western Reserve, and I was out there for 4 years. And then after that, I came back and did a 1-year internship in internal medicine at UC Davis at the medical center. Okay. And then after that, I ended up doing 3 years of anesthesia training at UCSF in San Francisco.
So in medical school, you can decide kind of which direction you want to go. When was it that you decided you wanted anesthesiology? So
in medical school, your first 2 years are mainly classroom work and doing, the basic sciences and learning the book part of it. Mm-hmm. And the third year is where you start doing your clinical work, and you get exposed to a lot of different specialties. And it was at the end of my third year that I decided I was going to go into anesthesiology. Okay. And I got a little bit of an experience from doing my surgical clerkship, and I did 2 weeks of anesthesia. I have an anesthesia clerkship in my third year, and that's when I made the decision.
Good. You still happy with that decision?
I'm very happy with that decision.
Good. So you got your internship out of the way and you're ready to go. What was the next step?
Well, so the internship is the first year, so you do that, and you either can do that in surgery or you can do that in internal medicine or pediatrics. Oh, okay. I got that out of the way, and then I ended up going to UCSF for the anesthesia training, and that's 3 years of basically all anesthesia. You do some ICU care where you work with internal medicine and surgery at that time, but for the most part, it's in the operating room doing cases and doing the anesthesia for those cases.
Wow. Okay. So when you finish that, how do you find a job?
Well, I ended up, ironically, just getting a pamphlet when I was in San Francisco from a recruiter, And my wife looked at it, and she could tell from the picture that it was Nevada City. And so we ended up calling the recruiter, and that kind of got us on the path to coming up to Grass Valley.
Good for her. And your wife is a Nevada Union graduate.
That's correct. Yeah, she she did her entire schooling here. So from, kindergarten all the way up through high school.
Great. So she was tickled to death, I imagine, to come back home?
She was very excited to come back home, yeah.
Now, at this point, did you have any kids?
Yes, at this point, when I got done with my residency, I had 2 girls. One was 2, and the other was about 6 months old.
Oh, boy. Get your hands full.
Yep, and even more full now.
Yeah. Now you got 4, and you're living in Grass Valley, and you've been here 14 years?
We've been here, 13 years.
Okay. And kids like it?
Yeah, my kids have loved it. Yeah, it's been great. We've been happy with the schools here. And one of the nice things about being here is, with the practice that I have, it allows me to have a nice balance between work and time at home. It gives me the opportunity to spend time with them and be involved in their lives.
So you coach soccer?
I've coached soccer for about now 6 years. And both my 10-year-old son and my 7-year-old daughter, I've coached them at various years. Never together, never both at the same time. And then I've also helped coach my son's baseball team.
Okay. But you said all 4 of your kids are swimmers.
All 4 are swimmers, yeah. They swim with the local club, which is Northern Sierra Swimming, and so they end up swimming every single day, and they swim every Monday through Friday every single day, and even when it's snowing, they're out there swimming, and they've been
Memorial Park?
No, yes, they swim at Memorial Park and Bear River. It just depends on where the practice is that day, so they alternate between the two, but mainly at Memorial Park.
It was 1994. I was president of the Grass Valley Rotary Club, and my project was to refurbish Memorial Park pool because it looked like Auschwitz. It was all cinder block and no plumbing. But it's gotten beaten up since. But it's still, the pool's good.
Yeah, it is. It works. They keep it nice and warm, which is good because even my 7-year-old will go in the water. And I've heard they're exploring getting a grant and refurbishing it again. The downside to that is if they do that, I think it'll be closed for a while. My kids are going to have to go all the way down to Bear River every day for their practice. Yeah. But I think long term, it'd definitely be a nice thing.
Definitely be. Okay, we got to take our first break. My guest is Dr. Tom Lucetti, anesthesiologist here at Sierra Nevada Memorial Hospital, and we'll be right back. Welcome back, everybody, to our Monday edition of On the Town, featuring your local hospital. And today we're talking with Dr. Tom Lucetti, anesthesiologist with Dignity Health, Sierra Nevada Memorial Hospital. So let's talk about the community. You're obviously involved in the community with your coaching and your practice. Grew up in Roseville. How would you contrast living and practicing here to a big urban area like Roseville?
Well, for one, just when I grew up in Roseville actually was more similar to what Grass Valley is like now than it is, but than now. Now Roseville is definitely more like Southern California. But practicing at a small hospital compared to a larger hospital, I always knew I wanted to be at a smaller hospital. Going through training, it's nice to end up knowing your surgeons, knowing your fellow anesthesiologists, and knowing the nurses and technicians that you work with. Where I trained at UCSF, we had 27 operating rooms. And so you ended up being shuffled around different places all the time. No one really ever knew your name. People would refer to you as anesthesia. And so I always knew I wanted to be in a more personal environment than that. And I've really liked being at a place where I know about the lives of the people that I'm working with. I know, you get used to it just like in playing a sport, like what they're comfortable with, what they're not comfortable with. You can tell when things are going well and when things aren't going quite as well. And so by knowing the people very well and getting very used to their style, I think it translates into actually better care. I think it ends up being the familiarity ends up really helping us provide better care for the patient.
Okay, which is absolutely what the community expects. I mean, they expect that quality of care when they come into the hospital. As far as this group, you've got an anesthesiology group, and I believe there's 4 of you involved in that?
That's correct. So we ended up having a individual group where we ended up usually having about 5 members in that group.
Okay.
And then we've ended up having some people leave the group. Just one of our members ended up practicing here for about 12 years and just decided he wanted to go to Wyoming. And so he ended up leaving California and working out there. And then we had another person who was basically taking his place, who ended up just being out here for a couple years and decided he wanted to practice back where he ended up coming from in Wisconsin. So he ended up going back there. And so because of that, because of the difficulty in recruiting physicians, we ended up having another group, Vituity, which is a much larger organization, come in and take over the contract. All the same providers are here, but they end up providing a management structure and support for us that we couldn't get as being a smaller group.
Where are they located?
So they're based in Emeryville. But they are all over the place. So they started out as California Emergency Physicians, and that was CEP. Mm-hmm. And because they ended up expanding their service lines into things like anesthesia and hospitalist medicine, neurology, psychiatry, they decided that California Emergency Physicians was not an appropriate name for them anymore. So they just recently changed the name to Vituity.
Has that changed the way your day-to-day activities as an anesthesiologist?
One of the really nice things about having Vituity come in is they allow a lot of autonomy for the individual sites. So we actually function as our own group to a large degree. Now we still end up having to meet the expectations and the goals of the corporation or the partnership. So, they want us to be practicing within certain parameters and doing things that they feel, uphold their values. But on a day-to-day basis, it really didn't change at all. We have the same providers. We are still actively recruiting for another physician, but we were doing that even before Vituity ended up taking over the management contract. But yeah, as far as my daily activities, it has not changed by having a new organization come in. It's really just been helpful on the sort of in the background.
So your actual employer is Vituity?
That's correct.
Okay.
We come in as partners, so we're not really employees. You actually come in as a partner,
okay.
But you're one of several thousand partners. Rather than being one of 4 or 5, you're now one of several thousand.
Wow. But that gives you access to all kinds of experiences people have all throughout the organization, I imagine.
Absolutely. One of the things that we've gotten by ending up going with Vituity and having them as the managing partner is we end up getting access to human resources and recruiting that we didn't have.
I was going to get to that recruiting.
Yeah, if there's personnel issues, so say someone for some reason is having communication issues with some of the hospital staff, there's more structure to help that person and also just help us provide better care for the patients. So yeah, and then and like you said, like we were talking about, and with the recruiting, we end up having access to having somebody being able to do that full time for us rather than do it after work or on the weekends, which is about the only time you have available if you're taking care of patients 40 plus hours a week.
Wow. Okay. So when did that take place?
That all took place in October. So that just recently
new.
Changed. Yes, all very brand new.
Wow. Okay. So you have periodic visits from their management team that come up and kind of talk to you and see what's going on in the community?
Yeah, that's correct. So we end up having there was a transition that occurred where they had a definite more active presence at the beginning, just to get a better idea of what the needs of the hospital were and what they would need to deliver to provide good care. And so they were here in July through October trying to figure those things out. Wow. And then they ended up yes, and then we have a regional director who we meet with and who comes to our meetings to check in and see how things are going.
So you're happy with the change?
I'm very happy with the change.
That's great. That's great to hear. Okay, we need to take our final commercial break. This is On the Town, featuring your local hospital on this beautiful Monday in Nevada County. Again, my guest is Dr. Tom Lucetti, and we'll be right back. Okay, welcome back, everybody, to our final segment for this Monday edition of On the Town, featuring your local hospital. Again, my guest is Dr. Tom Lucetti, who's an anesthesiologist, Dignity Healthcare, Sierra Nevada Memorial Hospital. Okay, so you chose anesthesiology. One thing I didn't ask when we were talking about your training was what that was like becoming trained as an anesthesiologist. Can you describe it?
Yeah, I mean, no matter what you do in medicine, when you do your residency, you're basically put in lots of positions that you're very uncomfortable with. While you do have training, there's some things that you're not trained for and that you end up having to adapt to. And so I was talking with someone just the other day saying how residency is one of those things, you look back on it, and you do look back on it fondly because you learned so much and it made you who you are today, but you would never want to do it again. So every day was a challenge, and being put in a situation that was not routine. And that's how you get good at what you do. And that's, being put in those situations, dealing with stressful situations. And, by the time you get done, you're actually usually very overtrained for what you're going to end up doing, which is nice because then when the rare event happens that comes up, you've seen it before and you know how to react to it. So
you come out of there with actual experience with having administered anesthesia to patients in the operating room.
Correct. When you end up doing your anesthesia training, from day one, you're put in the operating room and you're doing the majority of the case. Now, you have an attending anesthesiologist available to you. And as with any training, when you're new, they're right by you the entire time. And so the first 2 months, they never leave your side, and they're in the room all the time. By the third year, they come in and just check on you, infrequently. And they expect you to know to call them when there's an issue. They're always available, but they're not necessarily always present right there. So you do get to act and make your own decisions regarding patient care. And by that time, in your third year, you also have the experience to be able to do that safely.
What was it like the first time?
It's very scary. And there are many times you sit there thinking, I can't believe somebody allows me to do this.
Wow. So it's been 14 years, that you're 13 years in some, that you've been doing this. And how has it changed? How has that practice changed from when you were trained for those 3 years to what it is today?
So there are a lot of things that have changed. One of the main things is there's some new drugs that have come out that have made things easier and better. Drugs that are either shorter acting or accomplish what you want them to accomplish with fewer side effects. The other thing that has changed is there's a bigger push to do things as an outpatient. So they want the patient to come in from home, have their surgery, and then go back home and not stay the night in the hospital. So, and just even in the 13 years, that's really changed. In surgeries that people look at and go, there's no way. No one would have said, you can get your gallbladder out and come from home, get it out, and be back home in 2 hours. And, 30 years ago, no one would have thought that was the case. And now we do that routinely.
No kidding.
So that's another thing that's really changed. And then as an anesthesiologist, our role continues to expand. So one of the things that the American Society of Anesthesiology is big on is it's called the surgical home. And they want the anesthesiologist to be more involved in the pre-operative assessment and the preoperative care. Obviously, we've always been very involved in the intraoperative care, and we will stay involved in that. And then be more involved in the postoperative care. So the role of the anesthesiologist has really changed and expanded and continues to expand.
When I first called you this morning, you were attending to a patient. I believe it was the recovery room that I called, the number I was given yesterday. And the nurse I talked to said, "You are going to love this guy." So how's your bedside manner when you're dealing with these folks?
I like to think it's good, but I'm obviously biased. So one of the things to remember when you're taking care of patients who are coming in for surgery is they're very scared. And that's universally how it is. It's ironic that the more surgeries someone has, usually the less scared they are. But fortunately for most people, they don't have to experience a lot of surgeries in their life. So when they come in, everyone is very fearful. And so one of the big things you have to do is understand where their fears are coming from, understand that they're very scared, and try to make them more comfortable.
And you have a pretty good way about you for doing that?
I like to think so, yeah.
Okay. So what else can we say? Successful anesthesia care begins long before surgery is a statement I've heard. And you need to have a good relationship with your primary care physician. And how would you respond to that?
I absolutely agree with that. When we end up having patients coming in for surgery, the better care people have taken care of themselves, the easier it is to provide anesthesia for that patient. So when we end up having patients who exercise regularly, they don't smoke, they see their primary care doctor regularly, they take all the medications that they're prescribed as they're supposed to take them, that means their medical conditions are optimized. They're much more likely to have a good outcome from their surgery than someone who's the opposite of that, who is smoking and not taking care of themselves. One of the things we get sometimes is we have patients say, "Oh, I have no medical problems." And the first question I ask them is, "When's the last time you've seen your doctor?" Exactly. And you'll find out, it was 25 years ago. Well,
seriously?
There's times when that's the case. So it's seeing your doctor regularly, just doing the things that you need to do to take care of yourself, and that will just make it where all aspects of your medical care, including your anesthesia, are easier to deal with.
And then following surgery, after the patient is released from the hospital, your relationship with them is pretty well over?
For the most part, we end up checking up on them, and we end up making sure that their anesthesia experience was a good one. If they're in the hospital as an inpatient, we go visit them while they're in the hospital. But yeah, once we get done with the anesthesia and they go home, for the most part, then they follow up with their surgeon and then with their primary care doctor.
Okay. Well, Tom, we got about 30 seconds left. You're happy with your choice?
Please dial 6174. Dr. Ng, 6174, please.
You're happy with the choice you made to come to Grass Valley? Your family's happy here? Any of your kids interested in pursuing medicine? Because you have a 15-year-old.
Yeah, they do say they are. We'll see. I mean, it's a long road, so we'll kind of see where they go. I'll, support them in whatever decision they make.
Well, Tom, it's been a pleasure getting to know you. Thank you for taking the time out of your busy day, and thank you for what you do for our community hospital.
Thank you very much.
Pleasure meeting you.
You too. Thank you.
This has been Your Local Hospital on the Town, brought to you by Sierra Nevada Memorial Hospital Dignity Health. Listen to fourth Monday of every month to learn more about your local hospital.